Hey guys, Dr. Norris Goldberg here, owner and clinical director at Koru Chiropractic and Wellness, and I wanted to introduce Jorge Gonzales. He's one of our massage therapists and Rolfers is really his specialty. He's a Rolfer and structural integration practitioner. And today we really want to talk to you about the difference between massage therapy and Rolfing and really what the benefits of each of them are. They both have some unique advantages, and then also how you might best go about deciding which one is best for you. So let me first let Jorge introduce himself.
Hi, I'm George. I've been here in Koru Chiropractic for about, let's say 6 months or so, 7 months. But I've been Rolfing for about 25 years. Love the work. It's amazing how you can help and change people, improve whatever they're going through at that moment in life, whether it's a knee, a leg, a hip, a neck, spine, anything any kind of injuries.
Now, correct me if I'm wrong, but you started with massage therapy, and then as you kind of advanced in your practice, you've been doing it longer and longer. That's when you got into Rolfing?
Yes, I started massage therapy about 1999. Then it was great because I could help a lot of people loosen the muscles, release the spine, get some more movement. But then it was just so restrictive that I needed to learn something else.
Right.
So I graduated from Rolfing. I did Rolfing in 2002. I graduated. Then after that, I implemented other types of therapies. Muscle testing, emotional release, Hesh method, which actually helps realign the movement of a joint if it needs it, which I complemented with Rolfing, which is great because I loosen up the muscle and then make sure the joint also moves.
Excellent. And Rolfing started here in Boulder, right? Wasn't that like kind of where the fountainhead of Rolfing is?
Yes, exactly. It was a Rolf, originally from Germany.
Yep.
And that's why it's named Rolfing, because of her last name was Ida Rolf. But she actually named it structural integration, which is actually what it does. Align your body, helps you align your body from the feet up, because you could have something going on in the hips and it's just actually your foot. If you don't align the foot, then the hip won't go. And
kind of like chiropractic, we really look at it from an above-down approach, focusing on the nervous system, and if we can get joints moving, we can see different areas of the body benefit from that. Because it's going to help with neurological function.
Totally.
Rolfing is kind of similar, but through a different lens. They really, from what I understand, focus on interstitial, and that's also known as myofascial tissue, right? And by working on those tissues, that's when you can see some pretty profound changes, not just with pain, but really like your emotions, with things like digestion, right? Like it goes beyond just pain care, correct?
Yes, and one of the things that I find fascinating about the way that I work is that I can feel the blockages, and I can either work on a meridian or a muscle or a joint, which will affect other parts of your body to also heal and start moving.
Yep, and I've experienced this firsthand myself working with Jorge here. Sometimes he's doing things that he's barely even touching you. Sometimes even just working potentially with energy, and then he's like, now check out the range of motion. All of a sudden the range of motion will be better, right? Or the pain, the tenderness will go away, which I think is pretty cool.
And one of the things, I can do a lot of work and I can see you better, but the idea is for me to test before I do the work, so you can feel your body before I do it, and then afterwards so you can feel the difference. Because it's not necessarily just for me to tell you, yes, you are better. No, I want you to feel that what I did feels better for you as well.
Excellent. Now, that's what we love in this practice as well. It's like test, don't guess. Patients really love to see the assessment or the testing. They like to see what's going on as a baseline, and then when you're treating them or caring for them, then they can see those improvements, both how they feel, but also in other objective ways, like the way they're standing when they look in the mirror, or their motion in a particular joint, or in my case, things like X-rays or other test results, right?
Exactly. So before and after, it's important to give the client an awareness of where they're at, so they know where they are after the session. So it's amazing. It's great. So it's so much fun to go through the different types of techniques to get to one result. So it's not just Rolfing what I work with. I just go through a realm of techniques to help you the best of what your body needs at that time.
Absolutely. And similar to me, I use different techniques, but when you're becoming a master and you've been doing body work longer than me, so I would put you in the master category, but you start to just integrate it all, and it's truly fabulous work. I've seen patients essentially see you once and come over to me raving about how they want to do more sessions with you and how they've had these huge releases and breakthroughs. And okay, so let's talk about some of the highlights of traditional massage therapy compared to Rolfing. So let's start with massage first. You've done that for years. You even still kind of integrate aspects of that, but we also have other traditional massage therapists here at Koru Chiropractic. They do deep tissue, Swedish massage. Rolfing is definitely different than that. So let's start with massage therapy. What would you say are like kind of the highlights?
Relaxation, mostly.
Yep.
Get some blood flow. Maybe you have a knot on body part, and it will start getting some fluidity. Get some more, stimulate your immune support as well. But I feel like it's sometimes you've had an injury, let's say for 10, 15 years. The amount of scar tissue that your body has created will not release with a massage. So that's where you need to go a little bit farther and maybe go a little bit deeper and wait for that tissue to relax, to release.
Absolutely, and I've experienced that myself firsthand. You know, you wake up, you got a kink in your neck overnight. You could go get a massage and potentially get that released in one session, right? But I'm just talking from my own personal experience. I've also had some pretty, significant injuries. I've broken bones. I've had lots of scar tissue. I've had operations, and not until I've done really intense myofascial work and really both on myself and with other practitioners, but especially with you, I've had some big breakthroughs with range of motion and joints, and that's just by you getting your hands on there and really breaking it up in a way that traditional massage therapy might not get so deep or work on it in such a connected way. I think it's the connections that make the biggest difference, not necessarily the intensity, because with massage you can do deep tissue, but it's more of like hitting the trigger point, hitting the pain point, and you're looking at where's the pain, but also is that pain coming from somewhere else in the body?
How far away that restriction is coming from. And it's what's great is like while I'm in the session, I do some muscle testing. So I'm asking the body, do you want this muscle to go up, right, left, down? And it tells you, the body just tells you anything that's happening. Is it physical, emotional? So at that moment you ask, and then I either go through whatever I use, Rolfing, muscle testing, energy, or even emotional release. It could be.
Yeah, it all works. Now let's hit some of the highlights with Rolfing, some of the key differences compared to massage therapy that we might not have talked about so far.
The differences, massage, it doesn't create much change as when somebody has alignment, a physical misalignment. The tissue, the scar tissue, the fascia is so tight that it will not release. So that's where the Rolfing is needed, to wait for that tissue to let go so that then the bone, the structure can align.
Yeah, and again, if you get a big breakthrough with some of this myofascial work and you start to use that improved range of motion right away, that's where I feel like sometimes even a single session can get you a lot more results versus if you're doing just like traditional massage, you gotta like really work that spot a lot, many sessions in a row to potentially even make the same difference.
Totally agree. Many times I have, like a lot of people say, like at the beginning, Rolfing, they say that you need a 10 series. And I said, you better have one session is better than nothing, because you'll get to experience some improvement through your physical. One session is better than nothing. You don't need to do the 10 series. Of course, you do need several sessions in order to get you to 100% to treat the whole body in every different aspect as the body needs.
Well, and that's something else that I actually appreciate about you. I've done 10 series before. I've seen the progressive change in results, but you're, as a Rolfer, really flexible, meaning you are willing to work with people for a single session, show them what's up, show them how talented you really are, what kind of changes you can make with your body. And inevitably, a lot of people are just going to come back, right? So you're going to get a chance to work on all those different layers like you would with a 10 series, but you're easy to work with, I would have to say.
Yes, yeah. Some people want just their feet done, and I agree. If whatever you need done, let's do it. But I will recommend you other things that will make you feel better and help you release whatever your injury that you're going through.
Absolutely. So, some of the things that I focus on, but that you also are helping my patients with are chronic pain, posture, improved energy and efficiency, just because they are moving better throughout the day. improved range of motion in joints, that and flexibility. Like, and I've seen that again myself, but I've also seen that with patients who come and see you either before or after a treatment or even on a separate day. And then the emotional release too, which is we're gonna make a whole nother video for about this topic in particular. But a really good book about this called The Body Keeps the Score. And when we have a lot of intense stress or we've had some emotional trauma, there's parts of that get stored in our lizard brain, our brain stem, and our autonomic nervous system. Well, that's also connected to certain muscles and organs in our body. And so our body can get really tense and tight in a protective mechanism. And so it really, sometimes in many cases, you need to have therapy, like cognitive therapy or counseling. But if you don't get the body work done, you're not going to be able to get that entire issue solved and get that release that you're looking for your emotional scars.
No, I have seen a lot of clients that have had gone to a doctor, whether it's a emotional support, sessions, and no, I've worked over that, and I'm like, if you have resolved it, it wouldn't have shown up in the session. So it will show up. Sometimes you would feel very little change physically, but then, like, for example, last week a client came in and she's like, George, I don't know what you're doing, and but every time I finish, I feel a lot lighter, and my life is changing. Like, I'm making different decisions, things that used to get to me, and I used to get angry. Now I'm like, no, that's okay. I don't need to do that. And I've noticed that it's things that happened in my childhood.
Right.
So she didn't recall how all those things affected her, but then once all those things were resolved, she's noticing how she used to be and how she is now. So her body and her psyche, her emotional state is also improving. So it's amazing, very rewarding.
Awesome. That's the kind of work we love doing here. That's actually why we named the practice Koru. Koru is a Maori word from New Zealand, and it means new life, growth, strength, and peace. And our bodies are always going through an evolution. We're always being faced and challenged with adversity, and yet we have the opportunity to grow stronger from that, right? And to heal. And this is the wellness center that we've created here as a place of healing. So let me ask you, Jorge, what would you say is if someone calls you or someone calls in at the front desk here and they say, well, I can't decide, how do I do massage, do I do Rolfing? Like, how do you guide someone into deciding which one to do?
First you ask them what they want. Do they want to relax?
Right.
Do they want to just have a deep massage everywhere, relaxing? Some people don't know what Rolfing is.
Yeah.
So Rolfing is not, you can't do the whole body. Sometimes people want the whole body done at that time. And so a deep tissue massage or a regular massage would be really good for that. But if you have an injury, if something that's nagging you, then you do need Rolfing. You do.
Yeah, absolutely. And I kind of tell patients the same thing, if they're wondering, they're interested in getting some body work, or I'm recommending that they need some more body work on top of chiropractic care. If they aren't quite sure, maybe they've never had a massage before, they've never had Rolfing. In many cases, people have had a massage, but they're like, oh yeah, I did it at that resort in Mexico once, or I used to do it at that place where I had the membership, and it's really not even therapeutic sometimes at that point, right? And so then I'll say, well, you should really try both approaches, and then you can decide what's best for your body. But especially for a lot of the cases that I see, a lot of people coming in with injuries decades old, and they've got some really intense chronic issues. And if I think that they can handle, because Rolfing it's not necessarily doesn't have to be painful, but there's a different intensity versus like a Swedish massage. It can be very relaxing. You might fall asleep during the massage.
I have had clients fall asleep and they ask me, are you really doing it that hour like you used to the other day? And I'm like, no, it's just that your body released,
right? And
now it's not hurting as much. It's not that I'm working harder. It's just that there's more scar tissue in this area, which is that your body guided me to work. So I work on the other part of the body. So if it hurts on one leg, I go to the other leg. Look, I'm doing the same thing, and I'm like, it's not hurting.
Right.
Well, because that's not where it needs to work. So it's really not that it hurts. It's just that I get to find the areas that need to work, and then while it's releasing, you may feel some uncomfortable.
Yeah, same thing with chiropractic adjustment. And right before the adjustment, I usually ask, is that tender? Most times, yes, it is. I haven't even adjusted you, and I don't expect you to be sore or hurt from the adjustment necessarily. But there's tender points, there's inflammation, there's myofascial strain going on there. And so that's what we're trying to help with, right? And ultimately, we're trying to work you through those pain points. So, all right, man. Well, I feel like we covered it pretty wide and deep, and I hope that people who are watching this, hopefully if you're locally, you come try Jorge out. He's an amazing practitioner. Like he said, 25 years experience, really can deal with many issues, and I find him to be quite honestly phenomenal. I've referred many patients over to him, and if I could get all of my patients to see me and him, I think they would all benefit more. Genuinely, I think that'd be the case. So thanks for coming on and chatting with me today and sharing with the public about the difference between massage and Rolfing.
Yeah, and one thing we want to get in at last is like I've had from professional athletes to babies. I mean, literally from 6-7 months babies.
Wow.
All the way to athletes and 80-year-olds. So it's not like people say, "Oh, I'm too old and this is not going to help me." It doesn't matter how old you are. If I can help, it will work.
Yep. We're working on a case together, an 89-year-old with extreme hyperkyphosis. When he first came in, he was pretty much only able to look at the floor. And, there's some over curvature to his back still, but you should see him move. He's happier.
Yeah.
He moves easier. He breathes easier, and a lot less pain in his body. So he's really grateful that he's honestly found both of us.
We're happy for him.
Absolutely. All right, guys. We'll catch up soon. See ya.
Take care. See ya.